Hi everyone. So for today's discussion, I'll be talking about Dylan's case study. So first off, for the first question, we're given some values that we're supposed to explain kind of, if he's at risk for um, hypertension or basically what those values mean. So first off, Dylan's resting blood pressure of 142 over 92 millimeters of mercury classify him as stage 2 hypertension. As well as his family history for hypertension increases that risk for developing hypertension and putting him further risk for other cardiovascular diseases. Based on his BMI and waist circumference, it places him in the overweight category. This indicates he has an increased central adiposity, which is strongly associated with increased risk of cardiovascular diseases like hypertension. So basically, to just kind of explain what some of those values mean, blood pressure is determined by cardiac output and total peripheral resistance. Cardiac output is influenced by heart rate and stroke volume, while total peripheral resistance reflects the resistance within the blood vessels. So due to Dylan's sedentary lifestyle, he likely has an increased arterial stiffness and endothelial dysfunction, which result in reduced nitric oxide availability, and that decreases vasodilation, leading to that stiffening. This also leads to an increase in total peripheral resistance, so again, bringing that blood pressure up. Additionally, sedentary individuals often exhibit increased sympathetic nervous system activity, which raises heart rate and causes vasoconstriction. So again, another component raising that blood pressure. His increased central adiposity may also contribute through the activation of the RAAS, leading to an increase in sodium and water retention, higher blood volume, and increased cardiac output. And so all of these factors combined are contributing to his elevated resting blood pressure. So for the second question, we're going to talk about his exercise test blood pressure reaction. So during his exercise test, his systolic blood pressure increased while his diastolic blood pressure slightly decreased. This is a typical and healthy response to aerobic exercise or most exercise in general. So during his exercise, during exercise, metabolic demand increases, leading to that increase in cardiac output. So this causes the heart to pump more forcefully and increase stroke volume, resulting to more blood being ejected into the arteries and increasing that systolic blood pressure. During aerobic exercise, we typically expect that systolic blood pressure is going to rise progressively, about 10 to 15 millimeters of mercury per MET. And then diastolic blood pressure, we typically see it remain within less than 10 or an additional 10 to their resting levels. Like I said just a minute ago, it could go a little bit lower. So having a slight decrease is relatively normal. So the slight decrease in his diastolic blood pressure occurs because of active skeletal muscles release vasodilators such as the nitric oxide that I mentioned before, leading to that vasodilation and reducing total peripheral resistance. Additionally, as well as when you exercise, blood flow is redistributed, obviously, to those working muscles. So with vasodilation in the working muscles and vasoconstriction in non-essential areas. The decrease in peripheral resistance offsets the increase in cardiac output, so it prevents diastolic blood pressure from rising. So from a clinical standpoint, his response is normal. It indicates adequate vascular function during his exercise test. And then what we would expect to see for an abnormal response would be a significant rise or drop in diastolic blood pressure, so that would be greater than 10 millimeters of mercury, or an exaggerated increase in systolic blood pressure. So anything above 210 would be concerning and would suggest an underlying cardiovascular dysfunction. And on to question 3, some changes that he should expect with his exercise. So with consistent training, exercise training over a 12-week period, the initial change that we should expect with him specifically is obviously a decrease in that resting blood pressure. Typically, it should be 5 to 15 millimeters of mercury. This occurs due to improvements in endothelial function from that exercise, which will in return increase the nitric oxide availability and promote that vasodilation. As well as exercise increases the total peripheral resistance and decreases the sympathetic nervous system activity, which contribute to lowering that resting blood pressure. He would also experience a lower resting heart rate due to his increased stroke volume and enhanced vagal or parasympathetic tone. And then with exercise training, especially consistent exercise training, it increases plasma volume, which improves venous return and allows the heart to pump more efficiently. Over time, the left ventricle may undergo also beneficial adaptations, such as improving its ability to fill and eject blood. Another potential change is his improved body composition, likely due to his increased caloric expenditure through that exercise, and improved metabolic function. This can typically, changes in BMI or that waist circumference can typically depend on the exercise intensity and specifically consistency with the patient, such as if they're doing regular training in a rehab setting and then they're continuing that exercise outside, so they're meeting that 150 hours a week of exercise, then they should see changes in that metabolic differences. As well as with his regular training, it should often lead to, with those changes from the BMI and waist circumference, that will reduce his central adiposity, which will help further reduce the blood pressure because it's taking some strain off the heart. he should also experience an increase in his physical fitness endurance. He's going to get better at doing his normal activities. He's going to get better at doing, exercise and getting more comfortable with it. And so he'll have some confidence boost with that as well, mentally knowing that he can do more physically. With his consistent training, he will also be able to exercise at a higher workload with potentially lower heart rate and blood pressure at the same submax intensity. And then lastly, he will demonstrate a faster heart rate and blood pressure recovery following his exercise due to that improved autonomic regulation. So yeah.